your vision today. So I'm doing a bomb test. I'm going to check your Rosenbaum test. Arms length away. Check your arms length away. Check your nearsighted vision.
My main concern is our main corset shell.
Very good. So it looks like you're very good. So it looks like you're with corrective lenses. With corrective lenses. Okay. So I'm going to check your vision with the Snellen chart. So I'm going to have you hold the card for me. I'm going to stand about 20 feet away. I'm going to have you visualize the lowest line you can with your both eyes.
DEFPOTEC.
Cover one eye, please.
DEFPOTEC.
And the other eye, just read the lowest line you can.
DEFPOTEC.
Very good. So your vision is at 20/20 with corrective lenses. Eyebrows in your eyes. So I'm going to just palpate. Your eyebrows are nice and full and symmetrical. Is there any tenderness? The lacrimal apparatus.
No.
Okay, great. So your eyebrows extend from the inner canthus, to the outer canthus, and they're symmetrical and full. Your eyelashes on the upper and lower lid are full, and they curl outward. Your sclera is nice and white, and I don't see any lesions or any redness, and that is in both eyes. Your lacrimal apparatus is intact. I don't see any drainage. I'm just going to press to make sure there's no fluid. No fluid on that eye, and no fluid on that eye. I'm going to have you look straight at me, and I'm going to just get my flashlight, and I'm going to shine a light in your eye, see if they're symmetrical. Very good. So this pupil does, constrict when I shine the light, and that is called direct response. And then I'm going to shine the light in this eye again, and then both pupils constrict at the same time. That's called consensual response. That's intact. For accommodations, I'm going to have you look across the room, and then I'm going to have my focus on my finger, and I'm going to put it towards you. And both pupils do constrict, so that is a positive finding for accommodation. I'm going to do the H exam, which is to check your muscle balance and extraocular movement. So I'm going to have you follow my finger. We're going to start by going laterally, going up, down, back here, lateral the other side, up, and down. So that's nice and intact. Your extraocular movements are intact and strong and symmetrical. Now I'm going to check peripheral vision. So I'm going to have you hold that over one eye, and I'm going to visualize the same on the same eye. And I'm going to let me know when you can see my wiggly fingers.
See it. See it. See it.
All right, other eye. Superior.
See it.
Nasal.
See it.
And inferior.
See it.
Very good. So your peripheral vision is intact. Now we're going to have our ears, and they look very nice and symmetrical. I can make a line from your outer eye to your pinna, and it is even. And I'm going to visualize the inner ear. Is there any tenderness on your ears? And I palpate any tenderness on your mastoid process?
No.
Ear canal is pink. I can see some villus hair. The tympanic membrane is pearly and gray. I can see the cone of light, and the bony structures are intact. The whisper test, so I'm going to have you block your ear there, and I'm going to whisper 3 words, and you'll let me know if you can hear them.
Cat, dog, squirrel.
Okay, the other side.
Cat, dog, squirrel.
Very good, so that is intact. I'm going to do the Weber test, which I'm going to use a tuning fork, and I'm going to put it on top of your head, and you're going to let me know when you cannot hear it anymore.
I don't hear.
Okay, and I'm going to do it again on the mastoid process.
I don't hear it.
And then on your shoulder.
I don't feel it.
Okay, so it's like a 20-to-10 ratio, and your bone conduction to air conduction should be 2-to-1, and your air conduction should be greater than your bone conduction. I'm going to move on to your nose. Your nose is midline. Is there any tenderness on palpation?
No.
So the bridge of your nose is not tender, so that's great. I'm just going to look, and your skin color on your nose is the same as it is on your face, so that's great as well. I'm just going to look inside your nose. I don't see any drainage or any lesions. There's no discharge. The septum is midline, and that's what you want to see. I'm going to move on to your sinuses. Your frontal sinus, is there any pain upon palpation here? And any pain on palpation on your maxillary sinus? Very good. I'm going to shine the light just to make sure that there's good air, because we don't want it to be full of anything. I can see a good red visualization there. And on your maxillary sinuses as well. And there's air present in those sinuses. I'm going to move on to your mouth. Your lips are symmetrical, they're nice and pink and moist. If you open up your mouth for me, I can visualize your teeth, they're nice and white. The gums are pink and intact, there's no retraction. I'm going to look inside. If you open up for me, the hard palate is visualized. There's lateral rugae there. The soft palate is pink and moist. And stick out your tongue for me. That's nice and midline, pink and moist as well. No lesions or any edema. Lift up your tongue, please. That's very good. That's pink and moist. I don't see any caries noted. I'm going to just look inside your mouth. If you can stick out your tongue and say ah.
Ah.
The uvula is midline, and I do not see any tonsils present.